Welcome to Emergency Insights. I'm your host, James Carter. Today, we're addressing a serious clinical challenge, lithium toxicity. Lithium remains a cornerstone in psychiatric care, but its narrow therapeutic index makes vigilance essential. To guide us through this, we have a true expert with us today. Please welcome Dr. Emily Wang, a leading voice in emergency medicine and toxicology.
Thank you, James. It's great to be here to discuss such a vital topic.
Dr. Wang, let's start with the basics. Can you briefly explain why lithium toxicity is such a significant concern and how it comes to be?
Absolutely. Lithium is a fantastic medication for conditions like bipolar disorder, but its therapeutic window is very small. The key issue is how it's eliminated from the body. Lithium is almost entirely excreted by the kidneys. Therefore, any factor that impairs renal function or leads to an accumulation, like dehydration, a significant overdose, or the concurrent use of certain medications, can quickly push serum levels into the toxic range. This accumulation disrupts cellular function, particularly in the brain and heart, leading to a cascade of multisystemic effects.
That makes sense. The clinical presentation seems to vary a lot. How do we differentiate between mild, moderate, and severe toxicity, and what are the key symptoms clinicians should look for?
This is a critical point, as symptoms can be subtle and nonspecific initially. We classify toxicity based on both the patient's symptoms and their serum lithium level. In mild toxicity, typically with levels between 1.5 and 2.0 milliequivalents per liter, you'll see GI symptoms like nausea, vomiting, or diarrhea, along with a fine tremor, polyuria, and some cognitive slowing. As it progresses to moderate toxicity, with levels from 2.0 to 2.5 milliequivalents per liter, the neurological signs worsen. We're talking about confusion, ataxia, a coarser tremor, and even myoclonic jerks. Finally, in severe toxicity, when levels exceed 2.5 milliequivalents per liter, the patient is in a medical emergency. You'll see things like seizures, coma, severe hypotension, and cardiac arrhythmias. Early recognition is key to preventing these devastating outcomes.
Given that a patient's symptoms can be vague, what are the essential diagnostic steps we need to take in the emergency department?
First, a thorough history is paramount. We need to know about the medication history, recent dose changes, and any potential drug interactions, especially with common medications like NSAIDs, diuretics, or ACE inhibitors. Next, we must get a serum lithium level, but it's crucial to get a level drawn at least 12 hours post the last dose. This is the trough level and gives us the most accurate picture. We also need a full lab workup, including electrolytes, BUN, and creatinine to assess renal function, along with an ECG to check for any cardiac abnormalities. This helps us rule out other causes of the patient's symptoms and guides our management.
Once we have a confirmed diagnosis, what are the immediate management priorities?
The immediate priority is always to stabilize the patient, discontinue lithium immediately, and ensure a stable airway, breathing, and circulation. From there, the mainstay of treatment is supportive care. A large majority of these patients are dehydrated, so administering isotonic saline is critical. This helps correct their dehydration and, importantly, enhances the renal excretion of lithium. We need to continuously monitor their vital signs and cardiac rhythm because serious arrhythmias can develop.
You mentioned enhanced elimination. When is hemodialysis indicated, and what makes it the gold standard?
This is where knowing the thresholds becomes life-saving. Hemodialysis is the most effective way to rapidly remove lithium from the body. We initiate it for patients with a serum lithium level greater than 4.0 milliequivalents per liter, regardless of their symptoms. We also consider it for patients with levels over 2.5 milliequivalents per liter if they have severe neurological symptoms, are in renal failure, or if their condition is deteriorating despite supportive care. The key advantage of hemodialysis is that it not only removes lithium from the blood, but also from the intracellular compartments where it's causing the most damage.
Before we wrap up, what's one piece of advice you'd give to healthcare providers to prevent lithium toxicity from happening in the first place?
My top advice would be centered on patient education and vigilant monitoring. We must educate patients on the importance of staying hydrated, the symptoms of toxicity, and the dangers of certain over-the-counter medications. For providers, it's crucial to schedule regular serum lithium monitoring, be mindful of drug interactions, and perform dose adjustments based on these levels and the patient's clinical status. Prevention truly is the best medicine here.
Dr. Wang, this has been incredibly insightful. Thank you so much for your time and expertise.
My pleasure, James.
That's all the time we have for today's episode of Emergency Insights. We hope this discussion helps you in your clinical practice. Until then, stay safe and stay informed.